You trusted your doctor when they ordered that routine blood test last month, didn't you? You probably felt responsible, maybe even a little proud of yourself for staying on top of your health. But what if I told you that some of the most commonly ordered medical tests, the ones your doctor recommends without a second thought, could actually be setting you up for a cascade of unnecessary treatments, dangerous procedures, and health complications that might be far worse than whatever they were supposed to detect in the first place? What if the very system designed to protect your health is sometimes the thing putting you at the greatest risk? And the scariest part is that neither you nor your doctor may even realize it's happening. I'm Lauren from Lauren Wellcare, and I've spent over 2 decades in healthcare watching brilliant, well-intentioned doctors order tests that seem perfectly reasonable on the surface, but can trap patients in a medical maze they never needed to enter. I've seen too many people walk into their doctor's office feeling fine and walk out with a label, a prescription, or a referral that fundamentally changed how they see themselves and their health, often not for the better. Today I'm going to share with you 5 medical tests that are so commonly overused and misinterpreted that they might be doing more harm than good. And more importantly, I'm going to give you the knowledge you need to protect yourself and make truly informed decisions about your health care. Before we dive deep into this critical information, I want you to understand something important. This isn't about being anti-medicine or anti-doctor. This is about being a smart, informed healthcare consumer who understands that more testing isn't always better, that earlier detection isn't always beneficial, and that sometimes the kindest thing a doctor can do is not order a test at all. The medical system has created a culture where we believe that knowledge is always power, that finding problems early is always good, and that doing something is always better than doing nothing. But the truth is far more nuanced, and the consequences of over-testing touch millions of American lives every single year. If you've ever felt overwhelmed by medical recommendations, confused by conflicting test results, or trapped in a cycle of follow-up appointments for problems you never knew you had, then this video is specifically for you. If you're someone who goes to the doctor and feels pressure to agree to every test they suggest because you're afraid of missing something important, or if you've ever wondered why you seem to need more and more medical care despite feeling relatively healthy, then what I'm about to share could fundamentally change how you approach your healthcare decisions. And if you're tired of feeling like a passive participant in your own medical care, constantly reacting to test results instead of proactively maintaining your health, then stick with me because we're going to explore a different way of thinking about medical testing that puts you back in control. The first test that could be harming you is the PSA test for prostate cancer. And if you're a man over 50 or you have a man in your life who gets this test regularly, you need to understand what the medical establishment doesn't want to openly discuss. The PSA test measures prostate-specific antigen levels in the blood, and for years, doctors have been ordering this test as part of routine annual physicals, presenting it as a simple, harmless way to catch prostate cancer early. But here's what they often don't explain. Elevated PSA levels are incredibly common and can be caused by everything from riding a bicycle to having a urinary tract infection to simply being stressed about the test itself. When your PSA comes back elevated, and it very often does because the normal ranges are set so low that many perfectly healthy men exceed them, you're suddenly launched into what medical professionals quietly call the biopsy cascade. This means you'll be referred for a prostate biopsy, a procedure that involves inserting 12 to 14 needles through your rectum and into your prostate gland to extract tissue samples. This isn't a minor procedure despite how casually it's often presented. These biopsies carry real risks including infection, bleeding, pain, and in rare cases, sepsis that can be life-threatening. But here's where it gets really concerning. The prostate biopsies will often find what's called cancer, but much of what we label as prostate cancer is so slow-growing and non-aggressive that it would never have caused any problems during a man's natural lifetime. These cancers are sometimes called indolent or dormant cancers, and they exist in the gray area between normal tissue and dangerous disease. Studies have shown that if you biopsy the prostates of men who died from other causes, you'll find these slow-growing cancers in a huge percentage of them, Men who lived full, healthy lives never knowing these cells existed and never being harmed by them. Once cancer cells are found, even the slow-growing kind that might never cause problems, the medical system moves into action mode. You'll be presented with treatment options that sound urgent and necessary. Surgery to remove your prostate, radiation therapy, hormone treatments, each carrying significant risks and side effects. Prostate surgery can cause permanent incontinence and erectile dysfunction. Radiation therapy can damage surrounding tissues and organs. Hormone therapy can affect your energy, mood, bone density, and overall quality of life. These are not minor considerations, and they're being applied to treat cancers that in many cases would never have progressed to become dangerous. The tragic irony is that the PSA test was never actually designed for screening healthy men. Its creator, Richard Ablin, has spent years speaking out against how his test is being used, calling the current approach a public health disaster. The test was originally developed to monitor men who already had prostate cancer to see if treatments were working, not to screen men who felt perfectly healthy. When you use a monitoring tool as a screening tool, you get a lot of false alarms. And in medicine, false alarms lead to real interventions with real consequences. The second test that might be harming you is the mammogram, and I know this is controversial, because we've been taught that mammograms save lives, and that any woman who questions them is being irresponsible. But the truth about mammography is far more complex than the pink ribbon campaigns suggest, and every woman deserves to understand both the benefits and the very real harms before making decisions about screening. The fundamental problem with mammograms is something called overdiagnosis, which means finding and treating cancers that would never have become life-threatening. Mammography is incredibly sensitive, which sounds like a good thing until you understand what that actually means in practice. These machines can detect tiny clusters of abnormal cells called ductal carcinoma in situ, or DCIS, which technically gets labeled as stage 0 cancer. But DCIS exists on a spectrum from cells that might never change to cells that could eventually become invasive cancer, and we currently have no reliable way to predict which is which. This means that many women are being treated with surgery, radiation, and sometimes chemotherapy for conditions that might never have progressed to threaten their health. The psychological impact of a cancer diagnosis, even a stage 0 diagnosis, cannot be understated. Women describe feeling like their bodies have betrayed them, like they're living with a time bomb, like their entire identity shifts from healthy person to cancer patient. This isn't just emotional distress, though that would be significant enough. This psychological trauma can affect relationships, career decisions, insurance coverage, and fundamental life choices. Some women become hypervigilant about their health in ways that actually decrease their quality of life, scheduling multiple follow-up appointments, seeking second and third opinions, living in constant fear of recurrence. Then there's the issue of radiation exposure from the mammograms themselves. Each mammogram exposes your breast tissue to ionizing radiation, and breast tissue is particularly sensitive to radiation-induced cancer, especially in younger women. While the amount of radiation from a single mammogram is relatively small, it's cumulative over a lifetime of annual screening. For women who start mammography in their 40s and continue through their 70s, this represents significant cumulative radiation exposure to sensitive tissue. The younger you are when you start getting mammograms, the more concerning this becomes, which is why many countries with excellent healthcare systems start screening much later than the United States. The mammography process itself can be physically traumatic for many women. The compression required to spread the breast tissue thin enough for imaging is often painful, sometimes extremely so, especially for women with dense breast tissue, fibrocystic breasts, or those who are premenopausal. Some women describe it as feeling like their breasts are being crushed in a vice, and for women with a history of sexual trauma or physical abuse, the positioning and compression can be re-traumatizing. Yet women are often made to feel that tolerating this discomfort is a necessary part of being responsible about their health. The third test that could be harming you is the colonoscopy, and while colorectal cancer screening definitely saves lives, The way we currently approach it with routine colonoscopies for everyone over 50 creates its own set of problems that aren't adequately discussed during the informed consent process. Colonoscopy is an invasive procedure that requires sedation and carries real risks, including perforation of the colon, bleeding, and adverse reactions to anesthesia. While these complications are relatively rare, they're serious when they occur, and the risk-benefit calculation changes when you're talking about screening healthy people versus diagnosing sick people. The preparation for colonoscopy is itself a medical intervention with potential consequences. The powerful laxatives used to clean out the colon can cause severe dehydration, electrolyte imbalances, and in some cases, kidney problems, especially in older adults or people with underlying health conditions. The prep process is also extremely disruptive to daily life, requiring dietary restrictions, time off work, and arrangements for transportation since you can't drive after sedation. For many people, the prep is actually more unpleasant and risky than the procedure itself. But here's what's really concerning about routine colonoscopy screening. The procedure often finds and removes polyps that would never have become cancerous. Most colon polyps are benign and remain benign throughout a person's lifetime. However, once polyps are found, you're typically put on a surveillance schedule that means more frequent colonoscopies, sometimes every 3 to 5 years instead of every 10 years. This means more procedures, more risk exposure, more prep, more time away from life, and more anxiety about results, all to monitor and remove growths that likely would never have caused any problems. The economic impact of colonoscopy screening is also worth considering. A screening colonoscopy can cost thousands of dollars, and if polyps are found and removed, the procedure is often reclassified as therapeutic rather than screening, which can mean higher out-of-pocket costs for patients. The follow-up procedures recommended after polyp removal add up to tens of thousands of dollars over a lifetime, money that could potentially be spent on interventions with clearer health benefits like nutritious food, exercise programs, stress reduction, or other preventive measures. Here's something that might surprise you. There are less invasive screening options for colorectal cancer that are highly effective but much less commonly recommended. Fecal immunochemical tests, or FIT tests, can detect blood in the stool that might indicate cancer or large polyps. These tests are done at home, cost a fraction of what colonoscopies cost, carry no procedural risks, and when used annually or biannually, they're nearly as effective as colonoscopy for detecting actual cancers. But because they don't allow for removal of small polyps, and because they're much less profitable for healthcare systems, they're often presented as inferior options rather than reasonable alternatives for many people. The fourth test that might be harming you is the bone density scan or DEXA scan, especially as it's currently used to diagnose and treat osteoporosis in postmenopausal women. The fundamental problem with how we use bone density testing is that we've medicalized the normal aging process and turned a natural decline in bone density into a disease that requires pharmaceutical treatment. The diagnostic criteria for osteoporosis and its precursor, osteopenia, were largely influenced by pharmaceutical companies and create categories that include millions of women who would never suffer fractures related to their bone density. When you get a DEXA scan, your bone density is compared to that of a healthy 30-year-old woman at peak bone mass, not to other women your age. This virtually guarantees that as you age, you'll eventually be diagnosed with osteopenia or osteoporosis, labels that can fundamentally change how you see your body and your capabilities. These diagnoses often lead to prescriptions for bisphosphonate medications like Fosamax, Beniva, or Reclast, drugs that come with significant side effects including digestive problems, jaw bone death, and paradoxically, increased risk of certain types of fractures with long-term use. The psychological impact of being told you have weak bones can be profound and actually counterproductive. Many women become afraid to exercise, avoid activities they enjoy, and develop a fear of falling that actually increases their fall risk by making them more cautious and less physically confident. This fear can lead to a downward spiral of decreased activity, which actually accelerates bone loss and muscle weakness, creating the very problems the diagnosis was supposed to prevent. What's particularly troubling is that bone density is only one factor in fracture risk, and for many women, it's not even the most important factor. Factors like muscle strength, balance, vision, medication use, home safety, and overall physical fitness often matter more for preventing falls and fractures than bone density numbers. Yet the focus on bone density testing and treatment often overshadows these more practical and effective approaches to maintaining bone health and preventing fractures. The treatment paradigm that follows abnormal bone density testing is also problematic. The bisphosphonate medications commonly prescribed work by essentially poisoning the cells that break down old bone tissue, which sounds good in theory, but creates bones that are denser but potentially more brittle over time. These medications are designed to be used for limited periods, typically 3 to 5 years, but many women end up taking them for decades because doctors are afraid to stop them even when the evidence suggests continued use may be harmful. Right now, if you're watching this and thinking about your own experiences with medical testing, I want you to take a moment and really consider how these revelations are sitting with you. Are you feeling angry that you weren't given complete information before agreeing to tests? Are you feeling scared that you might have undergone unnecessary procedures? Are you feeling confused about how to navigate a system that seems designed to find problems, whether they exist or not? If any of these feelings resonate with you, I want you to know that you're not alone, and your feelings are completely valid. Take a moment right now and share in the comments below one medical test or procedure that you've had that left you with more questions than answers, or that led to a cascade of additional tests and treatments that made you wonder if you were better off before you knew the results. Your story matters because it helps other viewers realize they're not the only ones questioning the current approach to medical testing. Simply write something like, "Had a test that led to more problems than solutions," and know that by sharing your experience, you're helping to break the silence around overtesting and helping others feel less isolated in their concerns about modern healthcare practices. The fifth test that could be harming you is comprehensive metabolic panels and complete blood counts, the routine blood work that gets ordered at almost every doctor's visit and annual physical. These tests have become so routine that most people don't even question them. But they're perfect examples of how fishing expeditions in healthy people can create problems where none previously existed. These panels test for dozens of different substances in your blood, from liver enzymes to kidney function markers to blood sugar levels to electrolyte balances. And here's the statistical reality. When you test for that many different things, you're almost guaranteed to find something outside the normal range. Laboratory normal ranges are typically set to include 95% of the population, which means that 5% of perfectly healthy people will have results flagged as abnormal purely by statistical chance. When you're testing 20 or 30 different markers at once, the probability that at least one will be flagged as abnormal approaches certainty. This creates what's called the multiple testing problem, where the more things you look for, the more false alarms you generate. But these false alarms feel real to both patients and doctors because they show up as actual numbers on actual lab reports. When your doctor calls to tell you that your liver enzymes are slightly elevated, or your kidney function markers are a bit off, or your white blood cell count is just outside the normal range, it creates anxiety and sets off a chain of events that often includes repeat testing, specialist referrals, and sometimes invasive procedures to investigate abnormalities that were never actually abnormal in the first place. Many people have slightly elevated liver enzymes simply because they took acetaminophen the day before the test, or their kidney function appears reduced because they were mildly dehydrated, or their blood counts vary because that's what blood counts naturally do from day to day. The problem with treating these incidental findings as meaningful is that it turns healthy people into patients with conditions to monitor. You might find yourself getting blood work every 3 months instead of annually, seeing specialists who order additional tests, or worrying about organ function that was never actually impaired. This medical surveillance can become a significant source of stress and expense, and it often provides no health benefit while creating real psychological burden. What makes this particularly insidious is that once you're labeled as having abnormal lab values, even temporarily abnormal values, it can follow you in your medical records indefinitely. Future doctors may see these past abnormalities and factor them into their decision-making, leading to more intensive monitoring or unnecessary caution about medications or treatments you might need in the future. You can essentially be branded as a person with liver problems or kidney problems based on single lab values that were probably meaningless in the first place. The real tragedy of routine blood work fishing expeditions is that they distract attention from the things that actually matter for health. Instead of spending time talking about nutrition, exercise, stress management, sleep quality, relationships, and other factors that profoundly impact well-being, medical appointments become focused on chasing lab values and monitoring numbers. This medical model turns health into a collection of test results, rather than a holistic experience of feeling good and functioning well in your daily life. Now that we've explored these 5 tests and their potential harms, I want to talk about what you can do to protect yourself and become a more informed healthcare consumer. The key is learning to ask the right questions before agreeing to any medical test, and understanding that you always have the right to decline testing that doesn't feel right for you. The first question you should always ask your doctor is what they plan to do differently based on the test results. If the answer is that they would recommend the same lifestyle changes regardless of the results, or that they would just monitor the results without any specific treatment plan, then you need to seriously consider whether the test is worth doing. You should also ask about the false positive rate of any test being recommended. False positives are abnormal results in people who don't actually have the condition being tested for, and every test has a false positive rate. When screening healthy populations, false positives often outnumber true positives, meaning you're more likely to get a scary result that turns out to be wrong than to get a scary result that actually indicates a problem. Understanding this can help you make more informed decisions about which tests are worth the anxiety and follow-up procedures they might trigger. Another crucial question to ask is what alternatives exist to the test being recommended. Many conditions can be monitored through symptoms and physical examination rather than testing. Some tests can be delayed until symptoms develop. Other screening approaches might be less invasive or less likely to lead to overtreatment. Your doctor should be willing to discuss these alternatives with you and help you understand the trade-offs between different approaches. You should also ask about the natural history of any condition the test is designed to detect. Some conditions progress slowly and predictably, meaning that detecting them years earlier through screening may not actually improve outcomes. Other conditions are so rare that screening large populations will generate far more false alarms than true cases. Understanding the likelihood that you actually have the condition being tested for can help you evaluate whether the test makes sense for your individual situation. One of the most important questions you can ask is how the test results will affect your quality of life. Even if a test detects a real condition, the treatments available might be worse than the condition itself, or the psychological impact of knowing about a condition you can't effectively treat might be more harmful than remaining unaware. This is a deeply personal calculation that depends on your individual values, fears, and priorities, and no doctor can make this decision for you. I want to share with you the story of Margaret, a 68-year-old retired teacher who came to see me after becoming trapped in what she called the medical merry-go-round. It started with a routine physical where her doctor ordered comprehensive blood work as part of her Medicare wellness visit. One of her liver enzymes came back slightly elevated, just a few points above the normal range. Her primary care doctor, wanting to be thorough, referred her to a gastroenterologist who ordered additional blood work, an ultrasound of her abdomen, and eventually a liver biopsy to rule out serious liver disease. The liver biopsy showed mild fatty infiltration, a condition so common in people her age that it's almost normal, but it was labeled as non-alcoholic fatty liver disease, and she was told she needed regular monitoring. This led to repeat blood work every 3 months, follow-up appointments every 6 months, and dietary restrictions that eliminated many foods she enjoyed. She became anxious about her liver health, started reading about liver disease online, and began to see herself as someone with a chronic medical condition that could progress to liver failure. Margaret told me that before that first blood test, she felt healthy, energetic, and optimistic about her retirement. She was traveling, volunteering at her local library, and enjoying time with her grandchildren. After her diagnosis, she became focused on her liver numbers, anxious before every blood draw, and constantly worried about whether her occasional glass of wine or piece of chocolate cake was damaging her liver. She said the diagnosis had stolen her sense of well-being and made her feel like she was living with a time bomb, even though her liver function was actually completely normal. When I reviewed her case, it became clear that her original liver enzyme elevation could have been explained by the fact that she had taken acetaminophen for a headache the day before her blood work, something that can temporarily and harmlessly raise liver enzymes. Her subsequent tests were all normal, or showed only the minor changes expected in someone her age. The liver biopsy, which carried risks of bleeding and infection, had been unnecessary, and the ongoing monitoring was creating more harm than benefit through anxiety and medicalization of normal aging. Together, we decided to stop the regular liver monitoring and focus instead on the lifestyle factors that actually support liver health. Maintaining a healthy weight, staying physically active, eating nutritious foods in moderation, and managing stress. Margaret gradually regained her sense of well-being and realized that her obsession with liver numbers had been preventing her from enjoying the very life activities that were actually good for her overall health, including her liver health. This story illustrates a pattern I see repeatedly in modern healthcare. Well-intentioned testing in healthy people leading to findings that create anxiety and medical interventions without providing meaningful health benefits. The testing cascade, once started, can be very difficult to stop because both patients and doctors become invested in monitoring abnormalities, even when the monitoring serves no clear purpose and the abnormalities are likely meaningless. Another patient, Robert, experienced something similar with PSA testing. At age 55, his family doctor started ordering annual PSA tests as part of his routine care. For 3 years, his PSA levels were normal, but in year 4, his PSA came back at 4.2, just above the normal range of 4.0. His doctor referred him to a urologist who recommended a prostate biopsy, explaining that they needed to rule out cancer. Robert was terrified by the possibility of prostate cancer and agreed to the biopsy, despite his concerns about the procedure. The biopsy found what was classified as low-grade prostate cancer in 2 of the 14 samples taken. Suddenly, Robert went from being a healthy man worried about an elevated blood test to being a cancer patient facing decisions about surgery, radiation, or active surveillance. He was told that his cancer was low risk and slow growing, but the word cancer had such powerful psychological impact that he couldn't imagine not treating it aggressively. Robert chose to have his prostate surgically removed, a decision that left him permanently incontinent and with erectile dysfunction that significantly affected his marriage and self-esteem. 2 years later, when he came to see me for a second opinion about ongoing complications from his surgery, we discussed what he had learned about PSA testing and prostate cancer since his diagnosis. He had discovered that men with his type of low-grade cancer who choose active surveillance instead of immediate treatment have the same survival rates as men who have surgery, but without the life-altering side effects. Robert told me that if he could go back, he would have declined the original PSA test, or at least asked more questions about what he would do with the results before agreeing to it. He felt that the medical system had failed to adequately inform him about the high likelihood of finding cancers that don't need treatment and the significant quality of life impacts of prostate surgery. He said that while he was grateful to be alive, he often wondered if he would have lived just as long and much more comfortably if he had never had the test in the first place. These stories aren't meant to scare you away from all medical testing, but to illustrate the importance of informed decision-making and understanding that medical tests are interventions with consequences, not neutral sources of information. Every test should be considered carefully, with full understanding of what you'll do with the results and how those actions might affect your quality of life. So what can you do to protect yourself while still maintaining appropriate health care? The key is to shift from passive acceptance of medical recommendations to active participation in healthcare decision-making. This means preparing for medical appointments by thinking about your symptoms, concerns, and health goals ahead of time. It means asking questions about any tests or treatments recommended and not agreeing to anything you don't understand or feel comfortable with. You have the right to ask for time to think about medical recommendations before making decisions. Very few medical situations are true emergencies that require immediate action, and most screening tests can safely be delayed while you research your options and consider your preferences. You can ask your doctor to explain the benefits and harms of testing versus not testing, and you can request written information to review at home. It's also important to understand that you can request copies of your medical records and test results, and you should keep your own records of what tests you've had and when. This helps you avoid unnecessary repeat testing and gives you a better understanding of trends in your health over time. You can also research any conditions or tests online using reliable sources like the National Institutes of Health or professional medical organizations, though be careful to distinguish between marketing materials and evidence-based information. Consider seeking second opinions for major medical decisions, especially if you're feeling pressured to undergo testing or treatment that doesn't feel right to you. Many insurance plans cover second opinions, and the investment in additional consultation can be worthwhile if it helps you avoid unnecessary procedures or gives you greater confidence in your decisions. Remember that choosing not to have a test or treatment is also a valid medical decision, not a failure to take care of yourself. Sometimes the most self-caring thing you can do is to decline medical interventions that are likely to cause more harm than benefit. This requires trusting your own judgment and understanding that you know your body, your values, and your quality of life priorities better than any healthcare provider can know them. The goal of healthcare should be to help you live your best possible life, not to find and treat every possible abnormality that sophisticated testing can detect. This means focusing on how you feel and function in your daily life, not just on what your test results show. It means prioritizing interventions that have clear benefits for quality of life and overall well-being, not just interventions that normalize lab values or eliminate statistical risks. If you found this information helpful and eye-opening, I want you to consider subscribing to Lauren Wellcare, not because I need subscribers, but because you deserve to have access to honest, evidence-based health information that puts your well-being first. By subscribing, you're making a commitment to yourself to stay informed about healthcare decisions and to approach your health as an active participant rather than a passive recipient of medical care. This channel is dedicated to empowering you with the knowledge you need to make healthcare decisions that align with your values and priorities. We'll never talk down to you or pretend that medical decisions are simple when they're actually complex. Instead, we'll provide you with the information you need to ask good questions, understand your options, and make choices that support your overall quality of life. Every video on this channel is created with your specific concerns in mind, addressing the real-world dilemmas that patients face when navigating modern healthcare. We believe that you have the right to understand not just what medical tests can find, but what they might miss, what harms they might cause, and what alternatives might exist. We're here to support you in becoming a more confident, informed healthcare consumer who can work effectively with medical providers while maintaining autonomy over your own body and health decisions. By subscribing to Lauren Wellcare, you're joining a community of people who believe that good healthcare starts with good information, and that every person deserves to make healthcare decisions based on complete, honest information about benefits, harms, and alternatives. You'll never feel judged for questioning medical recommendations or choosing a different path than what's conventionally recommended, because we understand that the right healthcare decision is the one that fits best with your individual circumstances, values, and goals. The information I've shared today about medical testing represents just the beginning of what you need to know to navigate healthcare effectively. There are many other aspects of modern medicine that deserve careful consideration, from medication prescribing patterns to surgical recommendations to the influence of financial incentives on medical decision-making. As a subscriber, you'll have access to this information as we continue to explore how to get the best from healthcare while avoiding its potential harms. I want to be clear that this information is educational and is not intended to replace the advice of your healthcare providers. However, it is intended to help you become a more informed partner in your healthcare decisions and to understand that you always have choices, even when those choices aren't initially presented to you. The goal is not to avoid all medical care, but to make sure that the medical care you receive is truly beneficial and aligns with your personal health goals. Every person's healthcare journey is unique, and what's right for one person may not be right for another. That's why it's so important to have access to complete information about the options available to you, and to feel empowered to make decisions based on your own assessment of benefits, risks, and personal priorities. Healthcare should be a collaborative process between you and your providers, with you as the ultimate decision-maker about what happens to your body. Remember that you are the expert on your own body, your own symptoms, and your own quality of life. While healthcare providers bring important medical knowledge and experience, you bring equally important knowledge about your own health history, your response to previous treatments, your lifestyle factors, and your personal values and priorities. The best healthcare decisions emerge from combining these different types of expertise in a respectful, collaborative process. Thank you for taking the time to learn about these important aspects of medical testing, and for considering how this information might apply to your own healthcare decisions. Your health and well-being matter, and you deserve to have access to complete, honest information that helps you make the best possible decisions for your individual situation. If this video has been helpful, please share it with others who might benefit from this information. And remember that knowledge is power when it comes to protecting your health and maintaining your quality of life. The content provided in this video is for educational and informational purposes only and is not intended as medical advice, diagnosis, or treatment. Always consult with qualified healthcare professionals before making any decisions about your health or treatment options. The views expressed are based on current medical literature and clinical experience, but should not replace personalized medical care from licensed practitioners familiar with your individual health history and circumstances.